how to add the change dashboard provider function, that your OSP can add it for you. It's in the code, they just don't, it's a separate button or something that they have to turn on in the permissions, but that can be added to any dashboard that's already in there. And then Herb, maybe you can just review where the indicator library is found if you're able to. Are you able to show that quickly, or I can show it just on one of my slides if that's easier?
Yeah, I can try sharing the screen. I'm just not sure what they mean by indicator library.
Oh, I think what they're meaning is I was mentioning in my presentation that the indicator info is the it shows the query. So if you say, for example, in the disease
you're seeing
management,
my screen right now, right? Okay, so if you click on dashboard, okay, and you click on
go to that disease. Actually, I was going to say go to the disease. Oh yeah, actually you can do it from here.
Yeah. Okay. Let's say polyfrailty. No, probably disease manager probably would work better with it.
Yeah, it shows you a few more options.
So administration. Whoops, wrong one. Okay, dashboard. This one. Okay.
Yeah.
So, yeah. So let's do kidney disease. Okay. So if you click on options. Okay, you click on indicator information. This is what you mean, the indicator library right here.
That's right.
Okay, it's the top line here. If you click on indicator, then you get this blurb, and if you scroll down, and you'll see here, okay, right here, these numbers, they look like ICD codes right there. So 51, so it's essentially looking for 571, 573. Okay, so if you indicate at some point with a diagnosis of 571 or 573 in there, it'll show that it has chronic liver disease. Now, if you're one of those like super OCD people, I won't mention who, and you go into a subcode of 573, like a 5731 or 5732 or something like that, it actually may not pick that up because you've gone actually past where it was looking for. It was looking for a bit more generalized diagnosis. So just be aware of that. So if you're super OCD and you go really into detail with that code, it may actually miss it. Right. So chronic liver disease, let's see, for cerebral vascular disease, again, you can click on that and then scroll down and you'll see that the codes it's looking for are 430 right through those ones. So it does cover a broad range depending on how you want to diagnose those.
And I was just going to mention too that if you do use a code either in addition to some of the ones that are mentioned, or if you do code differently, then you just grab a report by template. There's lots out there. If you don't already have one, somebody will be happy to share it with you. I certainly have quite a few of those that I'm happy to share with people. So your PSP coach can get in touch with me and get them from me. And you can just search by report by template for that specific code that you're using.
Absolutely. And CHF, essentially just 428, that's it. And so if you want to see what it looks for, you can go through the different indicators there. And diabetes should be 250 and 250 and 250, and that's it, as expected. Okay, so all right, next question.
And John actually, I think, had something to add in.
Okay, John.
Well, I think I throw a challenge out to those dashboard report authors to fix that. We all know that ICD-9 codes have a 3-digit basic and multiple sub diagnoses that go past the 3rd digit. And a clever programmer could easily figure that out, and I'm not one of them, but I'm sure that the the pros can do that, and that would be something that we should ask for.
Yeah, it can be done. It's in the query, it's a like. Instead of an absolute match, it's a like. So that certainly could be tailored so that when you diagnose 250, it looks for 250 or 251 or 250 with the one at the end. So 2,501, I guess. But that is a like that you could add in.
Yeah, I'm not recommending that we do it individually. I'm asking the higher ups to do it for all of us so that we don't have to fiddle with it.
I agree. I just want to make sure that it becomes a 2501 and not a 7250 that it picks up.
Yeah, I think the problem has been some of the migrations from other EMRs chose some very obscure diagnostic codes to label their run-of-the-mill diabetics, and in the migration, like none of them came through with those disease registries, and you know, it wreaked havoc with those new users of Oscar that migrated from a system. I won't name the system.
And then somebody asked about oops, is that the one? No, that's not the one. They asked about 14066. Does it show the number?
That's in the BC billing dashboard.
Yes, as well. All right. There it is. Yes, of course. Right here. Yeah. So yeah. So your as Val said, your 14076 should be 0. Okay, because you shouldn't be using the 14076 right now. You should be using the 14707, right? Instead.
The telehealth fee.
The telehealth fee, the 707,
Yeah.
the Boeing. Yeah. Okay. Yeah, you should not be using
And
the 14076 at all right now. And I don't think we should be doing the 14078 either. It should all be telehealth. And the prevention in terms of how many you're billing. I think it's just by billings, not by paid, right? So,
I actually was going to say, I think it's by paid. Can we take a look at the indicator info and see if it tells us?
The billing master number is not null, and it shows as billed.
Just as billed. Okay.
And remain. Yeah, it shows just. Yeah, it looks like it's just as billed. That's my reading of it.
Mm-hmm. No,
Okay.
I would say you're right. Okay.
Great. And no change dashboard provider. I think we mentioned that already. You need to talk to your OSP to have that button turned on. And patients up to date, I think, has been mentioned that it. Okay. All right. Is there something more? Alice asked me in terms of consent. I mean, verbal consent right now has been stated to be acceptable, and you can write that in your note that you have talked to patient, gotten verbal consent for the visit and stuff like that. I personally think that ideally getting a written consent would be good going forward, but you know, for short, like one time, like now, you know, we don't have consent yet, but let's get verbal consent and go from there. But I think ongoing, you know, one should get some written consent. I don't know what the other users feel, but that's what I would think is probably a more ideal way going forward.
And there's another question that came up for understanding other EMRs have the ability to bulk bill from the dashboard for CDMs, and is this something expected to be added to Oscar? You can't bulk bill currently from the dashboard, but you can when you're in that dashboard looking at your CDMs that are billable. You do have a link right into their chart to go and do it. You do have to do it individually per patient. I haven't heard of anything coming down the pike for bulk billing to be able to do that. I don't know if any of the other people who are involved in that might know something that I don't, but yeah, I haven't heard of that, but you certainly can bill off the dashboard, just one at a time.
I always get a little nervous about bulk billing things without reviewing the chart, right? Because there may be issues, you know, that something's happening in there, like, you know, you may end up bulk billing a whole bunch of hypertensives and they tend to have diabetes or
right,
and you just didn't enter it in the diagnostic and the disease registry when they're actually diabetic, or they have CHF and stuff like that. So you're actually billing a lower code for hypertension when you should be billing the higher code and stuff like that. So although it's easier, I think it, you know, whenever it comes to billing and stuff like that, I just think it potentially it's a little bit too easy and too easy to make mistakes. So
yeah, I
would prefer, you know, from a safety potential, not just for your patient, but for yourself, so that you don't bill it incorrectly or you miss out on the actual proper billing, right? That you know, you do it individually one at a time, and then make sure that disease registry in that time is correct and stuff like that.
Going back to the consent thing, the verbal consent is okay, except that There's a bit of detail. There's a bit of granular information that's required. And if you say that they verbally consented, what exactly did they verbally consent to? And having a piece of paper that they've signed suggests, hopefully, that they read what they signed before they signed it. And then there's details in terms of what they've actually consented to.
And I'm just going to, go back to the billing again for one more thing. The other thing to just mention about the billing dashboard is that when it says a patient is billable and part of that criteria is that they've met the visit requirement, that does not, they're just counting the number of visits that you've seen. That's all they're doing. So say, for example, your hypertensive patient had seen you once for hypertension and seen you 3 or 4 times for his sore knee, but you hadn't discussed his hypertension or renewed a medication or anything, that actually, in an audit situation, you would actually not have provided the 2 visits required to deal with his hypertension. So just as a note for that, I mean, for the most part, any of your chronic disease patients, you are actually seeing them for that condition. And as long as it's in your chart notes, that's fine. But it does just count visits. It doesn't count the ICD-9 code that you used.
The question on progress on mapping the prevention, such as PAPs, mammograms, and FITs to the preventive area. That is, I think, the next big thing that's missing from OSCAR, and I'm not aware of anybody moving ahead with it. I'm not sure WELL has set that up, right, where if you get a PAP or a mammogram come in your labs, it automatically fills into preventions that it was done, what the results are, when the next one is due. I think that would be ideal, and that may be a project that users may decide it's important enough that they want to fund. Okay, because ultimately everybody can always ask for features, but at the end of the day, it has to be funded, right? So either your OSP has to fund it, or ultimately it's through you, or we crowdsource. That's how OSCAR has grown over the years.
It's all doable as long as the senders stick to conventions of how they label their reports. And we've all seen mapping issues where the lab sends us a numeric value and then throws in a couple of extra words, and then it totally messes up our mapping. So until they figure out what they want to do, it's hard to work with them when it's a moving target. But it's all doable, and I look forward to that. Currently, I'm doing it manually, which is a pain, but at least I have control over it, and it won't crash my system.
And there was another question about an easy way to check how many 14066s your health risk assessment have been paid for the year, other than getting a rejected one. I'm not 100% sure. I do have a report that I used to use in my clinic when I was there that does pull just the number you've billed in the year. And I think it might pull off the paid, not off the billed, but I'd have to double check that for you. But that would be the way. So the dashboard does, as we showed, does not do that. So we would have to have a report by template that looked for the 14066s that were paid, not just billed. Oh, and then I see another question for the CDM on the billing dashboard, that you have to have billed them once for that condition, as well as in order for them to show up on that dashboard. I actually don't know the answer to that. I'm not sure. Herb, is it possible to take a quick look at the indicator info again for that to see if that's true? I don't know that.
Okay, I'll take a look at the indicator. It's quite a complicated, long one.
Yeah.
With billing master, with billing status. It looks like it's just if it's been billed.
Okay.
But what do they look for if you're billing? Billing code 14029. Billing code 13. Oh, that's. No, I'm sorry. I'm not sure I understand the entire indicator, so I
Yeah,
can't answer that
same
question.
for me.
Offhand.
I can't answer that question by reading the indicator info.
Yeah, that's just a little bit too complicated beyond my
Yeah.
little simple mind.
Over my head.
Yes. Okay. So Andrea asked, is there a direct link to the consent form the patient can fill out online and sent directly to the clinic through Pathways? Yes, exactly as I did not make myself very clear, and I'll show it again. Okay. So if you go to Pathways and you go to your, you send your patient to, if you have set up yourself on the patient's medical care directory, and if you haven't, you should. Okay. So if you have set yourself up on the patient medical care directory, what you do is you send your patient to this site. So you tell them to go to Pathways or pathwaysmedicalcare.ca. So send them to that site. Okay. Tell them to go to that site. When they go there, search for you. Okay. So when they search for you, they will get your site. All right. And when they get to your site, tell them to click on your name, then scroll down and then see the consent for electronic communications. And if you just actually click on that rather than this over here, if you get them to click on the actual word that says consent, that will actually bring up the actual consent. They can then fill it out with their patient name, whatever information, demographics and stuff like that. Information, what they consent to, tell them to consent to everything, and then anything else, and then they have to sign it, what they are, and then they can submit it. Okay. Once they have submitted it, that will then go to your clinic email. Right. So if I wasn't clear, this allows you to avoid having to send them the actual consent. So the consent is there, they can sign that, and it will then go directly to your office email system, and then you can download that, put it into the patient's chart. So hopefully that's a bit more clear for you, Andrea.
So I did that recently, Herb, because I think it was one of the things I saw on Pathways, how we can access that, and you're promoting using that for our patients' benefit. You do need to set it up. I did not have any of those forms linked to my name. All it had was my address and such. So you make a change there. You do send the relevant information. You pick from a menu of items you wish your patients to be able to access. It's for the individual users, not for the entire clinic. Somebody will review it and check your credentials and make sure it's all on the up and up. You have to have an office email. I do not recommend that you use your personal email. Takes a few days and then it's approved. It's great. I just tried it out and it works.
Absolutely. If you haven't set it up, you can just contact Pathways to set it up. But if you have set it up, what you do is you go to your own listing yourself, just like I do, and you just click here and it says click here to make change. So if you don't have those forms showing, you can click on that. You enter your information here, and if you scroll down, okay, it tells you what information you want to send patients when they have flu symptoms. Okay, what your clinic offers, blah, 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 blah. But here are the forms, okay, that you want showing. So if you don't have any of those forms showing, you can click which forms you want right there. You enter the email address where your forms are sent. This email address is not released to the patients at all. Okay, it's just when they click that consent form or that WCB form or that pre-MVA form, that will then send that completed form to this email address. Okay. Any other additional information, hours of office, you click on that and you click submit. And the response time is usually within about 24 to 48 hours. Okay. So, and let's see if I can go to, yeah. trying to remember how to sign in for this if you don't have one. Okay, it'll come to me shortly, but.
I was just going to add into the consent part of things as well. One of the things that we were told is even if you don't offer one of the options that you're consenting to, Herb mentioned, have them check everything. Unless the patient does not ever want to consent to video or something like that, that's their prerogative. But even if you're not offering it at your clinic, it's better to just have them agree to it, because otherwise, if you do subsequently down the line add it, you would have to reconsent all those patients for that particular item. So unless the patient themselves does not want to consent to that ever, as far as they know, then I would recommend asking them to consent to it all. And there was another question in here, Herb, I'm wondering if I can prevail on you to demonstrate again. It says, can you show us how to use report by template? And I'm assuming that's just in general, if there is a specific something.
So
yeah.
Report by templates are under two places to get to it, either through administration or report. Okay, so I'm going to go through report. And scroll right down to the bottom here, it says report by template. Okay, so that's one way. The other way is to go through administration and under reports and report by template. Okay, so report by templates, you have to add to your, and it's clinic wide, right? So everybody has to decide what, there may be some added for you by your OSP when the system was set up, or there may not be. So everybody's is different, so I can't say what people have. And also your landing homepage may be different from this. This is an open OSP version. I think Well Health still has the older version, which is just a bunch of lines and stuff like that. It's not, it has a different font, but it works the same essentially. And you have a bunch of different reports in there, and I'll show you how you can look for reports that Val mentioned, or you can talk to PSP and they have access to them. So here's all the different ones from panel management that were created years ago. And I've labeled them A, B, C, D, E as I needed to go through them as I ran through them. So this would have, this is for disease registry and patients prescribed certain medications and so on and so on. Okay, so that was a bit of panel management back in the days before we had the dashboard. All right, so that's where you go. So where do you get the reports? You can talk to PSP. You can go to Oscar Canada. Okay. Go to Oscar Canada. Okay, if you type in Oscar Canada in your search box, okay, you can type up here actually John Robertson if I get it wrong. Okay, where's it in RBTs? It's over here.
Herb.
Yep.
Go up to Oscar EMR case management.
Right here?
There. Yeah.
Here, oh, sorry, here it is. Yeah. Okay, so it's right here. So if we go to Oscar users and then click on the Oscar case management, and it's right here under report templates. There is a group of templates here. So it is a little bit complicated to sort of dive through all of those things to find what it is, but there are a bunch in there. There's a tutorial how to do it. Yeah, go ahead, John.
So there are a couple of YouTube videos I have made about report templates that are on the Oscar BC YouTube page. So there's,
so if you go to Oscar BC,
yeah, they can go to those videos and.
Okay. And Oscar BC, those are resources, no, hang on. Where's it under?
Resources, I think.
Learning?
Yeah, under learning for the YouTube channel.
Yep, resources.
Yeah, there
here
it
it goes. Okay, so here's the YouTube channel. Okay. And yeah, so if users haven't gone there, you can go there, and there is quite a few number of different websites. This is latest, and then that clicks on, and this gives you the whole blurb of all the different videos, and reports would be where it is, right here. Report by templates. It's an 8-minute, 23-minute YouTube video, which you can watch, get some information how to use report by templates. So hopefully that answers that question.
I would also mention too that report by templates are one of the easiest things to share in OSCAR. So if colleagues have report by templates, ask them to share them. They can be emailed. So you don't have to physically go in and load them, and they're very simple to load. So that's a great resource for everybody as the OSCAR community to just get together and share the good reports that you have.
Yeah, and it's very easy to upload report by templates. They're just really text files. So what you do is when you get it, you just download them just like you do any file. Just remember where you downloaded it to, whether it's to your download folder or onto your desktop. Just remember that where it is. And then it's right here, it says add template. You click on add template. You browse for the site that you had it on. And then you click upload and add. Right? And then bang, you got it. You can group them together if you want into different types of templates, right? And by creating a group, and then within certain groups, you can again make it a little bit easier for you. The library now, at least this version of it, can now actually be sorted, right? And so eventually,
this is a brilliant addition.
Yeah, but it takes a few seconds for it to sort. Okay.
And Herb, you mentioned this early on. Prior to the dashboard, you were using RBTs for doing panel management, and indeed, if we use OSCAR properly and respect discrete data points, put items in the areas that they belong, the RBTs are extremely powerful. Mm-hmm. If you're looking for anything, almost anything in your system, a report by template can be created for it. But that assumes that you put, for example, blood pressures and the blood pressure measurements, and not just in the progress notes. So there are RBT programmers out there. They know this thing inside out. I'm not one of them, but my partner in the office is. So, it's out there for the asking. Sharing it may not be as easy as alluded to, because if you send files by email, some of our email providers actually filter out attachments. Anything that looks like it's an executable file may be considered malicious and not be sent that way. That can be a problem. Gmail seems to do that, so it's not so easy. And also, Juno users may not have the same libraries as WELL or OpenOSP. I found that some of the RBTs do not transfer across. However, the intent is correct, and those non-compatible vendors can modify them if you ask nicely, or maybe if you pay them.
As a librarian, if you do have things that you think are going to be useful for a large subgroup of OSCAR users, we certainly can get them onto both OSCAR Canada and World OSCAR, so that they then the whole email filter thing gets avoided, because then you can just download them off one of those sites. So that's another option as well.
And I know that for Juno EMR users, they do have a help library that's got several report by templates on it that you can just download off their site as well. So that's a good resource for people to look for. And there was another question, or actually a comment more to the point that I'm not entirely sure how to answer. So it says this panel management is heavily dependent on billing data, and I've recently migrated my EMR data from Wolf to Oscar and have been told by my service provider that I can't migrate my billing data, which is true. So how can I find a way to update my panel in Oscar? Off the top of my head, not knowing exactly what comes over in the data migration, again, it would probably be report by templates initially to search for either stuff that's been put into the medical history. I'm not sure on that. I'm not sure if anybody else has a comment on that. Otherwise, you might just have to wait till you do get some data into your EMR in order to be able to do your panel.
If this is something you really, really want to do and you're willing to spend some time on it, there are some report by templates that are free text searches, and they can search various components. They can search the encounter pane, they can search the history panel, that sort of stuff, but they are slow, and you want to do it when you're not going to interrupt everybody else's work. If this is something that you really are interested in doing, it is doable. It's not as nice and quick and easy as if all the billing information was there, but there are existing some report by templates that just do free text searches and can search various areas for this for you.
I'm actually surprised, shocked that an EMR doesn't have a way of tracking billing data that you can parse out and transfer over. That seems like a terrible system.
I would agree with that, but it is in any transfers I've heard about now, billing information never gets moved over. So it would be something that would be great to have that fixed up.
I was going to agree and just emphasize what John Robertson said, is if you run any of these free text report by templates, do it when the system, when other users are off, because you will really probably slow down your server significantly, and your colleagues will not be very happy with you when they can't open their charts.
Looks like we've gone through most of the questions, or all of the questions, I guess, at this point. So I just want to say thank you, Valerie, and thank you, Herb, and John, and everybody else for, either asking questions or giving ideas. I see a few people on there helping out, Ron Plowright as well. Super. If there's anything else, please direct your emails to us at OscarBC. It can be at info@oscarbc.ca. Follow-ups on that. There was some good ideas came up from this that I'll be following up with Herb and John on, and Valerie on some of these ideas that maybe OscarBC can help move forward in some way. Again, unless there's anything else, thank you to everybody for attending this beautiful day, and to our presenters.